Capitol. So now I'm joined by Tennessee Republican Marsha Blackburn. She has legislation. Everybody kept saying, to the Republicans, well, what are you going to do instead? Well, she has an answer to that. She's going to introduce a bill tomorrow that would replace the health care overhaul. She's the House Deputy Whip and also a member of the House Energy and Commerce Committee, and we welcome her. Congresswoman, good morning. Good to have you with us.
Good morning, Martha.
All right, so how long is your bill? How many pages?
Oh, my bill, I think, is about 11 or 12 pages. It's not very long at all. And what we do in this, there's a concept out there, Martha, everyone's familiar with. It's a cross-state line purchase of health insurance. And, of course, our colleague John Shattuck, who recently retired from Congress, spent many years working on this. I worked on it with him. And tomorrow we're reintroducing that bill. This will strike the insurance provisions in Obamacare, and it will put in place competition. Imagine that, replacing Washington mandates with free market competition. This is a way to lower costs and increase access.
These are familiar ideas that came up a lot during the debate, but, Robert Gibbs was at the podium yesterday. He says this isn't a serious effort on the part of Republicans. They know it's not going to go anywhere, not going to pass anything in the Senate, even if it gets heard, and then the president will veto it. So what do you say to that?
I say this is indeed a serious effort, and it is very serious for a couple of reasons. Number one, it is what the American people have told us that they want to do. They like the idea of reforming the health care processes, but they don't like this bill and the mandates and the government intervention that this bill brings. Another thing that they don't like is the cost that is associated with this bill, because any way you look at it, taking 10 years of tax revenues to pay for 6 years of a program is not going to work. And as we learned in Tennessee, when you try to deliver health care by mandate, by federal mandate, you're going to see your cost of that program quadruple.
But, they're basically saying this is a battle that you've already lost, that the people have heard your arguments, that the CBO, has scored this and that it is going to save money in the long run. This is their argument, of course. And also, that people are happy with it increasingly, that new polls show that the strength of fervor against this bill is diminishing.
I would disagree with that. What you're seeing from the polls is the majority of Americans want this bill off the books. They do not want the government intrusion. What they do want to see is accountability for insurance companies, pre-existing coverage allowances into the system. They want to see portability. Those are a liability reform. They want to see some reforms. They do not like this version of it. They want it off the books. So I would disagree with what you hear coming out of the White House. I would disagree with my Democrat colleagues. We know that any time you do this creative accounting and you take 10 years of revenues to cover 6 years of expenses, when you look at the long-term impact of what is going to happen with those bureaucracies and all of those 3,400 mandates, Martha, look at the other states that have tried this. The cost goes up.
All right. Well, you got an uphill battle, and we appreciate you spending some time with us. Congresswoman Marsha Blackburn, she'll introduce that bill.